My name is Morten Sodemann. I'm a professor of Global Health and Migrant Health here at Odense and Syddansk University. I think what's generally coming to my mind when I talk about it is sort of a dual way of thinking. One is thinking about complex problems, health problems that can't be solved within a country, and at the same time solutions that require that you sort of collaborate on a global scale. The biggest global health problems is actually defining them, because I think the basic problem is that we haven't really got the figures and the knowledge to decide which is the biggest problem. One of the biggest health problems could actually turn out to be like traffic problems, traffic-related problems in terms of health. I think, of course, the fact that the entire world are sort of converging towards suffering from the same diseases is also a process that we need to deal with now, because that means that the majority of the world's sort of future patients don't have access to healthcare that can actually deal with that fact. One of the challenges that global health hasn't really dealt with is that we lack knowledge in some fields. We have too much knowledge in some fields that's not used. So good knowledge is not used, and the systems to use knowledge is not in place. But also that we have fields where we are completely ignorant. It could be in immunology. Cheap interventions are probably hidden in better use of and understanding of epidemiology in a social context. Then there's sort of the whole aspect of the quality of care that poor people are met with when they see a health professional or meet the hospital. And that's really sort of an unused resource that you can actually have hospitals in resource-proof settings perform very well if you are highly educated or if you are willing to pay for it. But if you're not, you get a lousy quality treatment. So you can actually perform better just by sort of adding some incentives. And of course, education, better health education, and basically better education for the population, because that's one of the best remedies we have, good education. I think what has to be prioritized is to create sort of both the motivation and the environment that facilitates that donors, politicians, religious groups, and researchers sort of speak the same professional language, that they sort of they want the global development to move in the same direction, and that is the same sort of goal that we are aiming at, that people should be treated equal and then they're actually allowed to live a normal, healthy life. I seem to see a picture of global health sort of being a 20-year concept that is now fading out, and with the prospects of the entire world suffering from the same diseases, it might turn out to be, well, not in 10, but maybe in 20 years, to be an obsolete concept.